Alright, quick question. If you lost a tooth tomorrow, would a dental bridge actually save your smile or quietly cause bigger problems later? Music cue is rolling because today's topic is one of those treatments everyone thinks they understand, but almost nobody truly does. Dr. Esma, dentists recommend Bridgework every day, yet patients rarely hear the full story. Why?
That's exactly the issue, Rasim. Dental bridge work can be an excellent solution or a long-term mistake, depending on details most consultations skip. We're talking about hidden risks, lifespan myths, and why some bridges fail far earlier than patients expect.
So if you've ever been told this is the fastest fix, you'll want to stay with us. Because in the next few minutes, we're exposing what Bridgework really does to the teeth you keep, not just the one you replace.
And by the end, you'll know the exact questions to ask before agreeing to a bridge. Questions that can save your smile years down the line.
Let's make this real. Someone loses a molar, panics a little, walks into a clinic, and hears, no worries, we'll just do a bridge. Sounds simple, fast, reassuring. Dr. Esma, this happens every single day, right?
Every day, Rasim. And most patients don't realize that a bridge doesn't just replace a missing tooth. It permanently changes the healthy teeth next to it. Those teeth often get shaved down, even if they were perfectly fine before.
So people think they're fixing one problem, but they're quietly creating two new ones.
Exactly. Years later, patients come back with sensitivity, decay under the bridge, or gum issues, and they're shocked because no one warned them this could happen.
That's the part nobody puts in the brochure. This is where it really matters, because we're not talking about a short-term fix that quietly disappears. Dr. Esma, once a bridge is placed, that decision sticks with you for years, sometimes decades.
Exactly, Rasim. I see patients who had a bridge 10 or 15 years ago, and now the supporting teeth are failing. When one of those teeth breaks or gets infected, the entire bridge can collapse, turning one missing tooth into a much bigger problem.
So what started as a simple solution can snowball into more treatments, more time, and more stress.
That's right. And the tricky part is patients often blame themselves, not realizing the risk was built into the choice from day one.
Which is why understanding this now can change everything about your dental decisions later. Let me throw a quick real-world snapshot at you. A patient walks in smiling bridge placed 5 years ago, no pain, everything seems fine. Then one routine check changes the mood completely. Okay.
I see this often, Rasim. Studies and long-term observations show that a significant number of bridges start developing hidden issues within the first 10 years. Decay under the crowns, bone loss beneath the missing tooth, or stress fractures in the supporting teeth.
And the patient feels blindsided because on the surface, everything looked perfect.
Exactly. One mini case I remember clearly. The bridge looked flawless, but the tooth underneath was already compromised. By the time we caught it, the solution was far more complex than the original treatment.
That's when people realize the real cost isn't always visible at first glance. Alright, Dr. Esma, let's zoom out and put the science hat on. From a clinical standpoint, why is bridge work so controversial among dentists who focus on long-term oral health?
Great question, Rasim. Biologically, teeth are meant to stand independently. When you connect them with a bridge, you change how forces travel through the jaw. Research shows that uneven load distribution can accelerate wear on the supporting teeth and reduce bone stimulation where the tooth is missing.
So even if everything looks stable on the surface, there's invisible stress happening underneath?
Exactly. Over time, that stress can lead to micromovements, gum recession, and structural fatigue. It's not about fear, it's about understanding biology before choosing convenience.
That perspective alone can completely change how someone hears the word bridge. Alright, Dr. Esma, if someone is sitting at home right now with a missing tooth, feeling overwhelmed, what's the smart, step-by-step way to approach this without regret?
First, Rasim, slow down. Step 1 is a full evaluation, not just the gap but the gums, bone level, bite forces, and the health of neighboring teeth. Step 2 is comparing options side by side, understanding how each choice behaves over time, not just today.
So it's not about asking, can you fix this fast, but how will this affect me years from now?
Exactly. And step 3 is asking the right questions, lifespan, maintenance, and what happens if something fails. When patients follow these steps, they move from fear-driven decisions to confident ones.
That clarity alone can save people from years of unnecessary trouble. Before anyone rushes into a decision, let's draw a clear line between smart moves and common traps. Dr. Esma, what are the biggest do's and don'ts people should know?
First, big don't, Rasim. Don't choose a bridge just because it's quick. Speed should never outrank biology. Do ask whether the neighboring teeth truly need to be involved at all. Another don't is ignoring long-term maintenance. Bridges demand excellent hygiene and regular checks.
And the do's?
Do get a second opinion, especially if healthy teeth are being altered. Do ask what happens if one part fails. A good plan always includes a backup scenario.
That's the difference between reacting in the moment and protecting your future smile.